Very warm welcome, everyone, to Aarogyam Breathe Free project. It's a collaborative effort of Breathe Free, our new beginnings, and our rising beyond. But not to forget, our very close partner on the academic network is the Manipal University, Jaipur. So we are very pleased to organize this webinar, not only for Aarogyam extended family and the professionals group, but also we have opened this forum for other charity organizations who very often work with survivors, victim support. So this is one of the collaborative effort to reach out to all and also making sure that everybody feel inclusive in terms of understanding the best tools and techniques and coping mechanism as well as recovery mechanisms with the professionals, whoever supporting or going through this difficult journey. So just reminding on everybody's behalf, you're not alone. We all are here and we'll do in our best of capacity whatever is required. So on that note, I'm very pleased to welcome Dr. Sayesha Singh from Manipal University, Jaipur. She is amazing academician, researcher, but most importantly, very, very compassionate psychologist, lead psychologist. She's a mentor, she's a guide. The more I speak, the less it is on her credentials. But with Aarogyam, it is our collaborative effort, which we have been working for a while, and she's been shaping wonderfully the young minds, also the old minds like myself. So it's a pleasure to have her on board to understand the impact of trauma, impact of difficult conflicting relationship, as well as the family dynamics at times. So altogether, how the psychological interventions and the support can break these chains. Now, when we say breaking the chain, we are talking about the impact of these impact of the trauma and impact of the post-math, which comes as a limiting factor, quite limiting most of the time, so the people don't find any way out to move forward. So from her expertise, I would be hoping more to hear from the practical tools, practical support available on the common platforms which we provide. Not least by Dr. Manisha Patel. She is our consultant psychiatrist on Aarogyam. She's director, founder, and my partner, setting up the Breathe Free project, as well as many ahead later on, especially our United Advocacy Network, UCAN, where she is also shaping up altogether how the medical, social, and community dynamics altogether helps in this to make sure that survivors, the victims, the families, and everybody gets the equal access to the support. And you will be hearing me at the end talking about, again, my favorite brain neuroscience, but not the least, again, reviving from the trauma just by the knowledge aspect of it. So again, most of the time when we meet the victims, survivors, and even people in a significant distress, regardless of what life incidents, but the significant distress, whatever they have gone through or going through, it does influence the capacity of making decisions, cognitive skills, as well as sometimes literally taking the small and simple decisions. And at times, we don't find time to go through the counseling or therapy or anything. So the quick measures, which I often do very much personalized on spot, something to very quickly revive, at least this much to understand, to find a way forward. So again, I believe this collaborative expert panel would be able to answer your questions, but just for the safety and safeguarding of all, I would like to propose that the speakers speak first and share their insight, their expert opinions, and their practical tools first. And then when I stop the recording, I would welcome everybody to have open discussion with all of us together. So in that way, it's not being on record or recorded, which is going to be shared publicly. Just to remind again, today's recording will be shared publicly so that it can be accessed by everybody and anybody without having been accessed to the Aarogyam or not. So please make sure if you think of any question while the speaker is still talking, write it down, write it in the chat box, which won't come on record. But again, so you don't forget it. So when we are ready for the discussion and the discussion panel to open, please feel free to raise it or I'll read it for you. However, whatever you feel best, we all will help you to do that. So today, let's start breaking chains. And breaking the chains first is the stigma. My first, the take on the breaking chain was 3S, and three of the most difficult S in our lives is the stigma, silence, and shame. Once we do that, of course, rest is a history we all create, and it's a shining history we all make. So let's make a new history on this chapter with Manipal University first. So Dr. Suesha Singh, I would be very honored if you open the chair, please.
Thank you, ma'am. Thank you so much. Warm greetings to everyone. Thank you for joining us today for this very important webinar on breaking chains, a trauma-informed journey to empower survivors, understanding the unseen, and nurturing the unheard. I am Dr. Suesha Singh, and I'm thrilled to be one of the experts and one of the resource persons for this exciting and insightful session. Before we dive into the content and the discussions, I want to express my sincere gratitude to Aarogyam UK for having me on board, and gratitude to each of the participants for taking out time and to be here with us today. We understand that your time is valuable, and we are committed to making this webinar worth your while. Today's webinar is not just about sharing information, it's about creating a safe space for exploration and learning. We want this to be a comfortable environment where questions are encouraged, ideas are welcome, and collaboration is fostered. Feel free to express your thoughts openly and know that your perspective is valued here. We strongly encourage active participation throughout the webinar. Don't hesitate to use the chat box to ask questions, share your experiences, or engage with fellow participants. This is an opportunity for all of us to learn from each other. So let's make most out of it. I would also like to emphasize that we are all here because we share a common purpose, the pursuit of knowledge and growth. Let's harness the collective intelligence in this virtual room to explore ideas, gain insights, and leave a renewed sense of inspiration. So without further ado, let's embark on this learning journey together. Thank you all once again for being a part of this webinar. Let's make it a memorable and an enriching experience. So get ready, all of you, to dive into the content and let's explore together. So like ma'am mentioned rightly, the purpose of having this webinar, the main objectives that we are focusing on include exploring the principles of trauma-informed care. How important is it to understand the neuroscience behind trauma? And how do we offer empowering strategies to the caregivers and the survivors of trauma? So this session will basically guide the caretakers and also the trauma survivors towards healing, rebuilding a sense of security, and fostering trust. So we will be covering three broad themes in this session. Number one, like ma'am mentioned, we will be talking about the neuroscience behind trauma. What is the body-brain response in the aftermath of trauma? We will be talking about and discussing together the trauma-informed care principles, and we will emphasize on empowering strategies. We'll be talking about some practical approaches which will help in rebuilding lives with a focus on resilience and empowerment. So let's first understand what trauma is. What is a trauma experience? I would invite the participants to share their understanding with all of us. What is trauma for? How do we understand the concept of trauma? If anybody would want to share.
Yes, Pav.
Hello, everyone. Lovely to meet everyone, and hello, Dr. Singh. without being a proper understanding of trauma. If it was from the outside, to me, it's when you're when there's been like a disturbance in your vibration or your balance. So it can be emotionally, it can be physically, or it can be mentally, where your normal flat line has been disturbed and you've got the kinks in. And then you're having to unkink everything. But then you've got to find the strategies of dealing with it. And that's why, where you don't do it because there's a stigma or a shame, or you're having to be silent about it.
Right. Thank you, ma'am. Thank you for sharing that. Trauma, I believe, is a very significant issue for a lot of people who are experiencing it, and people don't really get an opportunity to vent out the emotions associated with trauma. It has been found through a lot of researches that strong links exist between how we feel, a lot of our physiological symptoms, and complex trauma. There are several negative effects associated with adverse childhood experiences, for that matter. Adverse childhood experiences may include childhood abuse of either physical, emotional, or sexual nature, family breakdown, exposure to domestic violence, or even living in a household which is affected by substance use or any kind of mental illness, any kind of emotional or physical neglect. So to find out what exactly is trauma, how many kinds of trauma are there, and how does it impact our brain's capacity to manage these distressing emotions which are associated with trauma, and what can be done during an experience like this. Some research is, in fact, one of my research projects which got published 2 years back. I worked on children with who've been traumatized, and we found out that unhappy childhood tends to result in unhappy adults. So, even it really doesn't matter in which age group trauma occurs, but different people are affected by trauma in different ways. It is something that's widespread throughout the world. It can affect all ages, all age groups, also people from different socioeconomic backgrounds, different cultures, religions, and even sexual orientations, for that matter. Anybody can be traumatized, but the experience is very unique. And because it is unique, it's important to address each trauma case independently, in a unique manner. So trauma can involve a single experience. It can be repeated experiences, which can overwhelm an individual's ability to manage or assimilate the emotions or ideas related to that experience. So traumatic events can happen at any age, but they can have long-lasting harm. Now, how do we understand what experience can we call as trauma? So any traumatic experience is characterized by three key features. So if you are a caregiver, or if you are rendering your services to any trauma survivor, it is important to identify these features. Usually any traumatic experience is very unexpected in nature. Trauma experiences, most of them are unexpected. The person usually is unprepared for any event like that. And thirdly, there's usually nothing that the person could have done to stop the event from occurring. So trauma events can involve, events like anything related to bullying, experiencing a disaster. It can be intimate partner violence, physical abuse, early childhood trauma, sexual abuse, etc. This is not an exhaustive list, but yes, these are few common, traumatic experiences or events that prevail more. So it is, it's very disturbing at times when we understand that trauma is not addressed properly. It is not identified, it is not acknowledged. And individuals, all of us humans, thankfully, we have this capacity to bounce back from adversity. So, it is not always dark and gloomy. Individuals can sometimes become more resilient through trauma, provided they have a strong support system after the event has occurred. Now, being caregivers, when we work in the community, and if we are a part of a support group for trauma survivors, we need to understand how do we harness this power that all humans have to help people grow out of trauma. So, in psychological terms, we call it as post traumatic growth. So, not all trauma will lead to disastrous effects, in the sense that it should not shatter the person. If we're able to provide good support to any survivor, we can help people grow from traumatic experiences. So these experiences often result, when an individual is unable to harness this power of resilience, of growing back and bouncing back from traumatic experiences. It happens when the support system is missing, or people who are handling traumatic cases, they don't understand certain nuances and intricacies that need to be taken care of and that need to be addressed when you are dealing with a trauma case. So usually when trauma is not addressed properly, the individual may experience feelings of shame. Now, trauma can impact an individual's identity. It can result in negative effects of the mind, the body, the spirit, and the soul. Everything gets shattered. There are some survival mechanisms that include blocking the experience from the memory completely, or trying to avoid any reminders of the trauma. So if the trauma is not processed, then it is ever present for the individual, and they will feel as if the trauma happened yesterday when it may have occurred months or even several years ago. So it's very important that the trauma is handled at the right time, and if not, the negative effects can be long lasting. Understanding different types of trauma can range from, like I mentioned, any developmental trauma. This can include child abuse, neglect, or even witnessing violence at home, to interpersonal trauma. Interpersonal trauma, again, is it's very prevalent, unfortunately, which, a few examples of interpersonal trauma can be, experiencing abuse as an adult. For example, domestic violence, or physical or psychological violence, um, you know any kind of, even witnessing violence at home can lead to a traumatic experience. Sexual assault, historical trauma, forcibly, for example, removal of the family from home, destruction of a culture, etc. Torture, bullying, LGBT abuse, and the elderly abuse also, which can take several forms, from being physical, sexual, financial abuse, spiritual abuse, cultural abuse, and even psychological abuse. So, developmental trauma, interpersonal trauma, we also are seeing around the globe some external trauma happening. And a good example here could be the wars that happen, the recent happenings in the geopolitical arena. So, fear of being killed, witnessing death, extreme suffering, migration can lead to traumatic experiences, deaths, dying, suicides, living in extreme conditions of poverty, natural disasters, accidents, etc. So, these are different kinds of trauma that people can experience. We don't even understand. Whenever we hear the term trauma, usually 2-3 popular kinds of trauma would come to our mind. Sexual assault, or domestic violence, for that matter. But trauma effects can, they lie in this whole range that I just mentioned. The trauma can result, you know, in changes to the brain. It is not only the psychology or the emotional health of the person, the mental health of the person, but rather there are some physiological changes that take place when an individual experiences trauma. It can result in a compromised immune system. It can increase physical and mental stress. It can decrease trust. It can lead to attachment difficulties, conflicting relationships, hyperarousal, hypervigilance, and rigid behavior. We'll be talking about some of these things in a while, but before that, I would briefly be talking about post-traumatic stress disorder, which is an anxiety disorder. It is caused by very stressful or frightening events. This usually occurs due to an incident that occurs once, normally in an adult life, typically involving unexpected sudden shock with unprocessed fear for life, manifesting as a post-traumatic stress disorder. It can usually develop in response to events that are perceived as threatening to one's own life, or witnessing acts of violence, or hearing violence or violent deaths of a close associate can lead to PTSD. Now, symptoms of PTSD may develop immediately after the event occurs. Sometimes the symptoms may develop over the span of weeks, months, or even years after the event has occurred. Now, how do we identify if somebody has PTSD? There are symptoms that we need to pay attention to as experts, as caregivers, as members of the support community. Please pay attention to any associate who may be re-experiencing the event in several other sensory forms. For example, any individual who reports having flashbacks or nightmares, anybody who's avoiding reminders of the trauma. By analyzing and observing their behaviors, you can, it's like a clue to identify some symptoms that may be manifesting over time. So chronic hyperarousal, for example, in the autonomic nervous system, anybody who has a chronic hyperarousal tendency would usually give very startled responses to the triggers, the day-to-day triggers that we come across. Trauma is a very complex concept. Experiencing trauma at a very young age, or having a history of severe repeated long-term trauma that includes exposure to caregivers who are rejecting, who are exploitative or unresponsive or violent, can usually lead to a very complex kind of trauma. So given that, complex post-traumatic stress disorder will have similar kinds of symptoms, but then they'll demonstrate additional difficulties. For example, anybody who is suffering from a complex post-traumatic stress disorder may show an inability to regulate their emotions. They will find it very difficult to self-soothe themselves whenever they are triggered by something in their social milieu. Individuals often become quite fragmented. That is, they split or they compartmentalize their experiences. They may also disassociate with people around them. There can be a chronic feeling of shame and guilt. Interpersonal difficulties are very common. They often find it very difficult to trust others or feel intimate with somebody. And a very, very common, a very prevalent symptom of complex post-traumatic stress disorder is somatization, which is the problem of feeling bodily symptoms for which no medical explanations can be found. For example, you'll come across patients who will report bodily pain which is unexplained. It's chronic in nature. It doesn't go away for years, and there's no physiological basis for the pain, but the symptom is there. That's a very good example because it's a very common symptom that we see in a lot of these cases with complex post-traumatic stress disorder. So, you as caregivers, it's important that we notice the difficulties that I just mentioned. These difficulties um, will give us a lot of information. It'll give us a clue to understand the underlying cause for what the person is feeling. The causes can be the traumatic experiences that people might have had. It has been found in a lot of research studies. We have scientific evidence for it. Studies have shown that many people who are diagnosed with borderline personality disorder, they have a history of abuse as children. Nearly 30 to 92% of the cases on which these researches have been done, this fact has been established. So it is very important to note that, you know, uh, our bodies will remember what our minds cannot. A recent finding is that, the younger the child, when the trauma occurs, the less likely they will, they will have had the ability to process what has happened to them. And therefore, the individual may not be able to process their trauma, and they may dissociate to survive, right? So all the symptoms that someone may experience because of trauma can be understood as the individual's way of adapting to deal with the overwhelming feelings which are associated with the traumatic event. Now, any traumatic event will adversely affect our nervous system. So, all of us human beings, we require a very safe, attentive, nurturing environment, nurturing relationships with other people. This is very important. Like if I talk about young children who are still developing, having a nurturing environment, having attentive caregivers and parents, having a safe environment to survive in, to thrive in, these are key factors that enhance the development of our brain. Okay, so these are and we all understand and know that our brain is responsible for managing, it helps us in managing our emotions. Now, without the availability of a safe environment, a support system, individuals may develop an overreactive threat response. Or on the other hand, these are like two opposite reactions that can happen: an overactive threat response or an underdeveloped self-soothing system. Our body's reaction to trauma usually sets up several changes in the brain. For example, when we sense danger, our limbic system, our brain, it gets into action. Some stress hormones are released, and these hormones get us ready for a fast, quick response. And this is not something new to this generation we are a part of. But even if you talk about the caveman generation, this same response has been prevalent um, uh, for as long as we understand human physiology. So whenever the crisis is over, the body would eliminate the stress hormones and we go back to the normal. Now, what happens when trauma occurs? If trauma occurs, especially early in life, and it lasts a long time, the effects become more persistent, and it is not easy to go back to the normal after a stressful event. So, our nervous system becomes primed to stay on alert mode. This alert mode is the overactive threat response to which we become used to. All right. So our stress hormones are chronically activated, and this is what becomes toxic to our brain's health, our well-being. And this interferes with an individual's ability to learn new things. They have difficulty remembering and learning because the alarm system is stuck on the alert mode. It's always on alert. So people impacted by trauma, they're usually startled more easily. They have trouble processing information. They have difficulty attending to social cues. They have difficulty sleeping. They tend to avoid situations that they believe would increase their stress. So that's how our brain gets affected, and our overall health, interestingly, it's this increased secretion of the stress hormone, not being able to go back to the normal state. This whole state can cause our cells to die in the hippocampus. Hippocampus is one important part of our brain. So, brain cells start dying. So this means that problem solving, thinking, perception, cognition, everything gets affected. And it becomes very difficult for people to self-soothe themselves. So we are always in the fight-flight loop. And sometimes what happens is that people may also become numb. They freeze their responses. Whenever individuals respond to traumatic events, they can either fight with it, they flee away, or they may disconnect, they freeze. So these are three ways in which we react to traumatic experiences. Now, it is very important to remember that people are resilient and they can adapt and they can change, right? So it all depends on how we process trauma, how it is addressed, and what we make out of a traumatic experience. Now, I will be talking quickly about one more interesting concept, which is the window of tolerance. The window of tolerance is a term that we usually use to describe the zone of arousal in which a person can function most effectively. So when an individual is within this zone, they're typically able to readily receive, process, and integrate information. Otherwise, they respond effectively to the demands of the everyday world. So when we talk about complex trauma or any traumatic experience, what happens is this window of tolerance, it narrows down. And when this window of tolerance narrows down, it usually leads to a state of either hyper or hypo arousal. So in these two states, that the individual is not able to function effectively, because hyper arousal would usually lead to fight flight states of anxiety, and hypo arousal will result into the individual freezing or going numb. So it is more common for people impacted by trauma to bounce back between hyper arousal and hypo arousal, right? So that's how we juggle between these two states. A lot of times you will see some comorbidity occurring with any traumatic experience. Survivors usually would report not of the trauma experience per se, but they seek out help for co-occurring disorders. Now, substance abuse, using substance for dealing with emotional pain and suffering, is very common amongst individuals who've experienced trauma, because, it is the quickest way to numb feelings. So whenever substance use is present, any assessment surrounding mental health should also consider any existing traumatic impacts. That's another key point that I want all the caretakers, members of the support group to pay attention to. Now, I will be summing up quickly by, briefing you about a few more, principles and guidelines which will help in creating a safe space, especially within the British Asian community. What are the key factors that are required for creating a safe space when you are discussing trauma with people around you? Please remember that being culturally sensitive is very important when you're dealing with a clientele who comes from a trauma background. Please ensure that the ethnicity, the language, the cultural background is taken care of. A safe space should acknowledge and respect all the diversities. Ensure that any discussion that you have with people from your community, it is culturally sensitive. There is a lot of stigma surrounding mental health. Mental health stigma can be prevalent in many communities, including the British Asian community. So creating a safe space helps counteract this stigma. And we have to ensure that we're able to foster an environment where individuals feel comfortable sharing their experiences without any fear of judgment. Also, these individuals, a lot of other communities for that matter, there is a lot of intersectionality of identities. Communities, you'll see a lot of communities often navigate multiple identities, which include cultural, religious, and gender identities. So if you provide a safe space, that's the first and the foremost thing that we can do for our clients, giving them a psychologically safe space so that they're able to recognize and respect these intersecting identities. We're able to acknowledge the unique ways in which trauma may be experienced. Also, like I mentioned a few minutes back, that sometimes traumas can have traumas can be intergenerational, or they can be historical in nature, such as migration experiences or community specific challenges can also be traumatic for people. So if a safe space is provided, it would allow for more exploration of these complex issues and their impact on mental health. Please pay attention to the language and communication styles that are used. Use language, keeping the linguistic diversity in mind. Trust is very important. Privacy and confidentiality should be respected. And you should customize support. Each individual's experience of trauma is unique. It is influenced by a lot of cultural, social, and personal factors. So if we give them a safe space, it will allow for customization of support, recognize and address the specific needs of individuals. So, talking about culturally informed healing practices and, empowering the survivor, giving them a safe space should be the primary focus. And this will not only facilitate healing, but it will also contribute to reducing stigma, promoting understanding, and building resilience within the community. Now, what steps can we take as mental health advocates, as members of the support community? How do we use these trauma informed practices? That's what we will be talking about now. So when you are dealing with people who've experienced trauma, be aware of their strengths. It's very important that we use the strengths based approach. It's important because viewing the trauma as an you should only view it as an injury that has happened, instead of a sickness from which somebody cannot recover. So do not focus on what went wrong. Rather highlight and consider what strengths the client has and work with the strengths of the clients. Individuals usually they cannot think, or they cannot self-soothe when they are experiencing extreme trauma. So do not ask anybody to calm down when they are angry, for example. De-escalate rather than confront. Help the client to calm down and then discuss what happened. So these are few tips and tricks that we can use to deal with people who've experienced trauma, using appropriate language, acknowledge silence as a way of communicating, clarify anything that you do not understand or are confused by, ensure that you don't re-traumatize the person by asking him or her to narrate the whole trauma experience again. So psychoeducate, use psychoeducation, use grounding techniques for stabilization and self-soothing. Breathing strategies work really well. Distraction and mindfulness, self-compassion. These are all very popular strategies that can be used with the trauma survivors. So yes, that's all from my side. And if you have any questions, you can put that up in the chat box. I'll be glad to take the questions. Thank you. Over to you, Dr. Manisha.
Thank you, Dr. Singh. It's amazing compilation, and you have covered everything so beautifully. Just from my end, again, just one thing I would add on, and that's you haven't missed, but I learned recently. The tone also matters. Sometimes we don't realize that when they are in a very fragile conditions, and the way we present as a support workers, our tone, we're not even considering that what tone and what pace we are talking, but sometimes that itself set them off, and it's not very uncommon that that jumps off and they go to shut down again. So it's highly sensitive networks where we need to consider that how we approach. And the most common mistakes in the support network we could ever make is being suggestive. So the one thing I would say, never ever give suggestion or be an instructive suggestion, do this and do that. That's a big no for any of us working in a trauma support network. Last not the least, Dr. Suesha Singh already has covered most categories of trauma, every category of trauma. But there is one new emerging category from the medical health perspective, which is very common now we consider as a trauma category, which is long-term illnesses. So you must be wondering that why I constantly talk about trauma in Aarogyam, because I do recognize Aarogyam is one network highly specialized with the community members struggling to cope, manage, and deal with long-term illnesses. We all are struggling with fibromyalgia, to chronic pain, to fatigue, to diabetes. All of this is long-term illnesses. And the ones people are diagnosed with these long-term illnesses, the trauma is unavoidable. And sometimes we even know that we don't know who came first. So is the hen or the egg? So again, it's a question that did the trauma trigger the illness, which we didn't know having the impact, or actually long-term illness triggered the trauma? But they go hand in hand. So if we are looking at 5 to 7 years, we see these changes in the brain already. Even that has nothing to do with brain, it has to do with pancreas. So in these networks and in these scenarios, the responsibility comes to everybody's shoulder, because it's everybody's business, looking after each other and making sure that we don't provide suggestion, but we help them to make those their own choices, making sure that they find help in themselves and the strength to cope and to move forward. So we are here only as a silent witness and support, but the biggest one, what they need right now, because the whole world already has traumatized with the suggestion. So on our Aarogyam community, I know that this is what I'd say to my support teams, who are very highly skilled, but I still have to remind sometimes, please, no suggestion, watch your tone, watch the language, because that's what we have the first bond in the support. Without taking much on, Dr. Manisha ji, I
Ma'am,
know.
I'm sorry for interrupting.
No,
There's one more important point that I would like to mention here. It's very important that the caregivers take care of their mental health also, because when you are listening through the traumatic experiences, you're working with these groups very closely. Self care for the caregivers and the support group members is also equally important. So please practice some self care strategies for your own self also, and don't let your experiences of past trauma overshadow in any way people you are reaching out to for providing help. I think that is also something we should take care of. Thank you.
Must take care of. Thank you for adding on. Thank you, Dr. Singh. Manisha
Thank you.
ji.
Thank you. May I just add? I'm
Yes,
working in
please.
a psychiatric ward and working with people with tremendous amount of trauma. One of the things I would just want to mention that I use the techniques of yoga and breathing exercises to bring them to some form of ease and comfort and a safety, giving them safety as well. Because otherwise, for them to open up, it's vitally difficult, and the difficulty they find in doing that. And then I move on to the other parts of the sessions, and then I may even go to asking them about their purposes. So it's a diversification of different things to do. I just want to find out. This is one thing I haven't worked really very much on is the trimmering techniques. Have you all used the techniques?
By different name, and I think you and I have to talk because this is my specialty area, and I do, but not with the same name. But yes, we do the check of different ways and the yoga techniques. Would that be still okay for us to talk after the session? And I'll let
Yes.
Manishaji take over. Yeah,
Yes,
I'll leave
certainly.
my number and we'll carry on.
Thank you so much. Thank you.
Good afternoon and welcome to everybody. Now, I think Dr. Suresha has explained most of the things in connection with the trauma. It's a fight and flight technology mechanisms which has been uninhibited, and then the people come up with a sudden shock or a long-term shock or a that's a long-term sort of abuses, various kind of abuses that they come up. So most of the things she has already stated about the trauma. Now, but in short, this trauma word wasn't there before. That trauma was just like it's a fear, basically. That was a fear people were coming up in the olden eras. Now we are taking over with these. Now, as the time changed, there were a lot of things happened, but just this one, it doesn't come up, it gives you. Now there are many of the people who are professionals, so they all are aware about the basics of the traumas, but then the general people, they don't understand the world. Oh, I've got this, I've got that. So I'm talking in a generalization term. The caregiving term is already been explained very, very well by Dr. Suresha. Thank you very much for all those informations. Now, when we are talking about these trauma, when our brain and body, when we are functioning, it functions like as an interrelationship for every external messages. Anything, when you are going a professional life or when we are doing our day-to-day job or anything, the brain and the body, whether it gives you yes or no, sometime the brain has to accept it yes, or sometime it says no, and then you work accordingly. This is one part of the things which is happening in a regular life. And when you are in a work or wherever you are, the thing comes up every day. Like, okay, fine, today you have to finish. A very simple examples, it's like a professional life where you go and you have been said about it. Okay, you have to finish with this much of a filing work. Okay, it's your choice whether you accept it or not. That's your brain says. Your brain says yes, okay, fine. But then when the time limit given and then you have to accept it, okay, fine. You're accepting it or not. Your brain has to say that. If it doesn't and still you do it, you are inviting trouble. Yeah, maybe you're driving and you've seen the people. I've come up with so many cases like that who have seen the murders in front of the eyes and they haven't come out for so many years and they have persisted that particular symptoms of murdering, that they run out of the hospital the moment they see a little knife or something sort of a thing, a weapon in a hand. That's what it happens. This is a PTSD, a very simple example I tell you about, a very simple way that I can talk to you. A stress is that your brain has accepted the filing, okay, I have to submit it. And then you can't. So again, the pressure comes. First time you fought for that. Okay, now I must remain awake. I have to do this, take a cup of coffees and teas, and then you try to finish it. But what you're doing, you're giving a stress to your body. That stress is very dangerous. In the same way, in a house, the children or a husband or a wife, it's like every place in a simple way, it's every unacceptable diversification, distressful conditions happening, circumstantial, or whether it's a conditioned arousals or shocking, abusive, any of them. You see once, okay, you fight, oh, get away with it. You can get away once, twice, thrice, but it comes again, again, and again in your life. Then what's the position? What do? Then the stress, that stress becomes unbearable. Sometimes you just get shocked. So it's blocked up because you've seen such a thing which you have never been able to see. As I said about the murdering somebody, and you've seen with the naked eyes, and you are going to witness that fear, it's very, very shocking for you. So that's the one part. One part is where you have taken it every day, routine life for slapping and stabbing and alcoholism in the house, and then the person is doing like a substance abuse, I would rather say. And then the people are just here, and it's a bizarre house, and so many things are there. This is one. It's for a child. And what's the position is? Why it happens? You've taken. Now, these are all the external diversifications where the corticosteroid hormones and the secretions in our HPA, that is our hypothalamus, pituitary, and adrenal axis, is getting imbalanced. Once, okay, fine, the brain has already turned. What is hypothalamus? What is pituitary? And what is adrenal? They are all the glands which are controlling the hormones in our body. They are releasing the various hormones, which are, we call it as a steroid hormones. And the basic one is a corticosteroid. Corticosteroids, they are engaged with so many activities and so many different emotionals and other platforms of performance of our body. At that time, when it is happening, the hormone imbalance, hormones gets fluctuated. They are like a key factor for your body. And then the complete. Now, if these hormones is doing regular way, okay, fine. You can do your job every day, every time properly. But in case if it doesn't happen because of these constant external distressful positions that you have to fight, that's a fight and flight mechanism. You get away once, you get away second, you get away third, but then you can't. That is impossible for you. You go to the football match and you get aggressive, and then your fight and flight mechanism, oh, lovely. This is a part of aggression. It's a part of it's an anger because your team has been defeated. So that's an anger. But that's once. Every time if it happens, gone. But this is like an incident. Now, certain incident where you are talking about the traumatic, these are the regular. It's a long-term bereavement. You have to come out in certain time. Otherwise, you are caught in this. PTSD is a shocking. What happens? Suppose you have seen a very simple example. You've seen someone murdering, and then you haven't seen anybody. You've seen the person's bleeding coming out. He's been shaking, and then you are shocked. Like you're driving a car, and on the opposite side, you've seen the accident, and the person is fallen out. So now, always remember these kind of the incidences which are there in your life happens. It's a shocking which you have never ever been experiencing. So in a simple way, that time you are numb, you're shocked. So it becomes hyperarousal. It is a totally blocked mechanism. And your hormones, they are caught at that time. Your hypothalamus, pituitary, and adrenal axis becomes absolutely imbalanced. And you come up with the long-term mental health problems, or you are mentally caught, and that's a PTSD, or it's a traumatic effect, which is there. And then how it happens afterwards. Okay, done, happened. But after some time, after a long time, this particular picture doesn't go away from the brain. Means they block one part of the brain and they keep on remembering you like a nightmares, like these. That's a PTSD. But the shocking part is when the children, when they are being brought up in unhealthy, unproblematic situations. I'll give you about the biogeosem and what are the replications of it. I'm coming up with that. But this part, when it becomes prolonged, you are caught It's an abrupt arousal or a long-term an abusive, stressful scenario. They create a long-term mental health problems. Make sure that you are any small diversification, even if think about it, even somebody's biting you, somebody's killing you, you get, oh, I got this. This is a part your reaction starts. I told you about sometime, okay, very simple. You are caught in these with the official or a professionalism, and you get away while having a long cup of tea or a coffee or a cake and these and that. Fine. Your glucose balance, because what happens at that time? Your glucose in your body goes down, and then you have to balance that. So to balance that, you eat it, you're out of it. Don't take alcohol, don't take coffee, don't take other type of the caffeine or thing, but a water, cake, a cup of tea or some more, you're out once. But then it doesn't work. So that's your caught. So remember one small thing. It's a day-to-day life, social life. Secondly, I have seen the papers and I have gone through the papers and we have done the work on where the economical situations are not right. The people who are living in absolutely, it's a lower standard of living, and the requirements are higher and you can't cope up. These are where the argumentative nature happens and the kids or the family is affected. There is a side reactions of the substance abuse increases. So it's a social events. And there you people have to be very careful, especially a person as a person should understand. Caregiver comes later on, the GP comes later on, the doctor comes later on. But when you find this, sit down when you're calm. That's the thing which is true. When you come, think about it and carry on with it. That yes, I never had that before. Why I can have it? And this kind of a situation can put you through very drastic, very drastic events or a very drastic mental health positions, and you're fallen into it. Anyway, now let's come up. What other application? I will wind up because most of the things have been covered by Dr. Swesha. So I just have to give you a very brief, in a way, how can we take it over? Now remember, when such situations are happening, in a very simple way, what happens? Either you are already having some genetical problems, or in the child, the mutational effect happens and your mutations or your DNA and your genes are getting affected, and then you're bound to caught with it. Now why? Suppose in a socio-eco conditions, as I said, that your house has got these problems, and then you take a permanent alcohol or substance abuse or something, lots of quarrel and violence and these and that, the child doesn't get on with that. They come up with the problem, which is called as dysthymia sort of a problem, which is in a long term, it's called as a bipolarism. And then what happens? Your child has affected. It's a vulnerability. The child becomes vulnerable. The poor child has done nothing. It's just you guys, you people, your problem. You're coming up with it and it has happening with him. A parental capacity. The people does not have that capacity to have with 2 or 3 children to give the proper education, upbringing, nurturing, and then they have those kids. And then they have to work hard, they get tired, quarrel, fight, all those things. Secondly, you're exhausted with the work. So you yourself are tensed, you yourself are stressed. Then that long-term ones, that burden, that internal quarrel of the family, it's every part that the parental capacity comes. Then abuse, desire. It's a financial desire, it's a sexual desire, it's a economical desire, it's a family desire, any of the desire. You don't get it, and then you fall into it. Then second is with the cultural myths. Oh, you don't do this, otherwise they will hammer you. Don't go there, it's not a right thing. The cultural thing. What happens? All those things, they built in a family, in a person, and then that gives us the insecure attachment, whether you are talking about professional, whether you're talking about marital, whether you're talking about family or family relatives, or it's a community, anywhere, you get the insecurity with the relationship. And that replication comes with the child, with the family, with the husband, with the wife, with the old age people. Old age people are also one of the affected ones in these kind of cases. And then that becomes a real big problem and antisocial behavior. So the children are falling into antisocial behavior. The mother or a father also, they fall into the wrong guidelines and the wrong problems. And that is not the right thing, which is for a family too. So what happens when these kind of a thing happens? This is these genetical problems. Now, some parents, they don't understand, because I've come up with so many patients who have already got the schizophrenia or they have got the bipolarism, but they don't understand that. And then when they have, when the children, they show some improper or inappropriate behavior. Why my child is like this? Why I'm like this? Why my daughter has got these? Because you understand, you had a quarrel, your children are brought up with that quarrel, and that vulnerability that they have seen, they have grown up, they are inbreeded in them, and you didn't realize then. Now we are talking about. So, it is like a long generations to generation it goes on. Now the child is affected, it will again happen to their children. So it's a genetical. So remember, these all the kinds of a thing which are biological, physiologically also it affects, sociological, your life is gone ruined. You can't have a experience the pleasure of the life, harmony of the life, freedom of the life. So that is affected. And then your personality, very important factor. Your personality develops accordingly. That's why I use the antisocial. Very important word that I was using there. After all these, when it results, it's a long-term trauma. Your child is seeing this, a husband and wife every day fighting, taking a drugs, and a father coming and substance abused and come home and they're beating and eating, and all those things the person is seeing. Post-traumatic disorder, where the person has seen these shocking things, but they can't get away. But the parent doesn't realize this. Or the person or the family members doesn't realize, oh, that's is happening. It's okay, fine. But then after so many years, when it starts showing that the abnormal behavior at that time, they realizes. So now at those particular incidences, they creates this personality. And some of the personality where the depression occurs, anxiety is, of course, one part of it, which has been right from the beginning that they are seeing, and they have been developing slowly and slowly, which is generalized and chronic and multiple things, which is there. But they develop a lot of other behaviors as well, like a narcissistic personality, revengeful. There are 56 personality in general that I have come across with. And then that is, where the people, they become violent, they become antisocial behavior. They, some of that, they become such a way that they try to save money. They become so selfish that, oh, it's only mine. They don't give it to anyone. They fight. Some of them, they create such a personality that if that kind of a person comes, they start fighting with them. And there are a lot of such kind of a thing which we are seeing even in the movies, in the short films, quite a lot of things. So these are the ones. So these are the traumatic results, and that results in the mood fluctuations. Sometimes it's, split of the mood. Very simple. Split personality. One point you are perfectly fine. Other side, you are totally revengeful. And that revengeful nature will let you go even to the murdering. That kind of a people are also there. So these are the personalities that the people create, and that's a narcissistic personality. There is a personality where they create a gullibility, they create a selfishness. So these are all the very big, and that's a trait. And they come up at the end of the day, they come up with the depression, they come up with the anxiety, and quite a lot of problems. So remember, trauma is not just the one. Trauma gives you a lot of problems in your life and lot of things. As I was talking, long-term trauma is a very important. Trauma PTSD is one side. Long-term trauma is another side. And that long-term trauma will definitely put you into the bipolarism. For the childhood, if it develops, it's a depression, it's a dysthymia. And then as it grows, it becomes a bipolarism. It's another thing is that you're coming up in certain age of the traumatic stage once when you're passing through, that is a wrong personality. You can't see anybody growing up. You can't see anybody nurturing well. You know, that is the negative. That negative thing keeps on building, and that becomes your habit. That becomes your nature. You say your personality is like that, but this is what it happens there. And that's very important factor that you have to see. Oh, he's a negative person. He's like that. So that's a one kind. Now, now, now second part of it is the last one. Now, how can you do these kind of a thing? Dust down and have a freed life. Now, to correct this, we have got a lot of things. As a psychiatrist, I can tell you pharmacy, pharmacological guidelines, multiple medicines, SSRI, antipsychotic, antidepressants, you name it, we can give it to you. Fantastic. But there is, of course, there are side effects, and of course, they're enveloped with a lot of side effects. Non-pharmacological interventions, they are there. Medicine, pharmacological. Well, they are there. Very quick remedy. Quickly, you are out of it. But then you're enveloping a lot of underneath problems as well. Create your testings done. We doctors, we get your corticosteroid testings done, these, that, HPXs, all this, we do it. We have got our testings done. We have got our measures. We got our machines. We do. Afterwards, we measure your quick. We got your IQ done, everything, blah, blah, blah. Everything is being sorted out, and then we give you medications. But quick actions and side effects, we are enveloping, we are carrying with you. We can't say no to it because your situations are so severe. Even I tell you about these traumatic effects, the bipolarism, the psychotic problems, even the pregnant woman, they carry with them, they carry with the children. So these, please, 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 everybody, now to live in a harmony. Another thing, you have got your choice. As I said, your brain is your mastermind. Your body and a brain interrelationship, mastermind relationship, where you can go for a non-pharmacological interventions. Long-term, nice, but they are very good. Where you can have the cognitive behavioral therapy or acceptance and commitment therapy. Accept it. This is a challenge, and that will come slowly. The psychologist will tell you slowly, yes, you got this. And that's where Dr. Suesha is fantastic. She said that calm down. They come to us. We listen to them individually. It's like, you are giving wiring their brain. Your brain was destructed, and now you're coming back to the things. You're coming back to wiring condition. Calm down. Listen to them. And now you're getting back into it and accept it that you got this problem. Work out, and slowly, you can work up with the things and that kind. And then you're committed. The person, see, it's a 6-step therapy, but that 6 steps works for you. And then you can see, oh, wow, I was like that before. I can see some changes in me. And that's where end up with the therapy. And that's the acceptance. Accept where you have got a problem. Accept it. Work towards the problem. Commit towards the problem and fight to the problem. That's where yoga and meditation will give an energy to fight and flight mechanism, which has been disrupted, which has been abandoned, which was been blocked because of the problems. And you come up with that. So I would like to wind up with this because I know you people must be having a lot of questions. And thank you very much for Dr. Neha Sharma to give me all this opportunity. You being a wonderful partner and wonderful colleague to me, I'm so much obliged. Now, I just leave it to the people what they want to ask to us and their queries are.
Manisha ji, just before we go, because I'll be stopping recording, so making sure everybody can ask freely. But before I stop, yes, there are two questions which is very, very relevant, which I can address just because I want everybody to be part of it. Both are relating to the therapeutics, both are relating as a solutions. So yes, over the years of research and over the years of understanding the post-trauma effect and the brain involvement into long-term illnesses to any other part as well. And as I say, my expertise extend on these areas because I think it's been 20 years. I've been on these networks where I have started with seeing the most horrible crimes and victims, which starts with children, child abuse, child trauma, childhood abuse, and extreme, and rehabilitating them to the society and the lives with the most challenging issues. So starting from there, I think what I have learned, and this is where what we all as a professionals has worked through all these 2 decades, has been a tremendous journey, and it's not hopeless journey, believe me. It sounds like there is no way out, but once the human capacities is incredible, and once we tap into it, you see the journey and the healing and recovery is just, the words, he's already out of it and thriving. And the most exciting part, when people mostly ask me, how do I see all this? And I said, no, I don't see pain anymore. What I see and what thrives me to continue doing it when I see them walking free from trauma. And that's for the question that when I say chicken and egg, we don't know which came first. What we know is what to do with both. So when this is a situation that trauma, fibromyalgia, you name it, any long-term illnesses, which is like cancer diagnosis is trauma in itself. Just the diagnosis, I'm not even talking about the treatment and recovery, because the very first thing hit hard is a grief, and that's the trauma itself, a complex one. So any of these diagnoses, when they are coming out and where they say quite clearly, no treatment yet 100% effective, yes, that do strike us bad. So in those situations, we do deal with quite a lot of techniques, which starts from the rewiring. Rewiring is not a real scientific term, but we use in a general way. We start from there because brain has the capacity to direct the body, and the symptom management becomes easier. However, we do both ways. So wonderful. Somebody really shared a wonderful technique of yoga. Now there is a very slight balance between when we use the technique of holistic therapies. There are stages when we introduce and it works tremendously well, and there are stages when we modify them to reintroduce for the specifics we wanting. And this is where, whether we are using a technique of yoga or technique of any other psychological intervention, most of the time we do modify according to individual, according to the whole health perspective. And in most years, that has been found the most effective management. So as a care professional or as an expert, however you are introducing these techniques, making sure that they are safe and most effective in their way. Mostly these are safe, but the most risky complication of using any of this without knowing the good background of the participant, the client, or the patient or victim, and using as it is, could actually strike the trauma. It's very commonly we have seen that symptoms aggravating, and it's not the side effect of yoga, actually is the wrongdoing of those practices for the wrong person. He's not ready yet to be practiced these. We had done a beautiful study recently in this year in May, sound healing. Sound healing has been a tremendous journey on Aarogyam community, and we still don't let go. We still meet once in a month with Debbie Walker. And I think in my whole career, this is most fascinating evidence-based I have seen, where people has been coming back and telling me, still coming back and telling me what all wonders it did. Now, when we started this intervention, we were harmless. It's just listening half an hour music, and there's nothing, no harm done there. But what we understood in the first 2 weeks, people actually, the trauma resurfaced. Now, that's where we understood that it's a part of a healing, but we were not prepared that the trauma will resurface. People will feel overwhelmed. They'll start crying for no reasons, and it's anxiety will pick up again. And then suddenly when that happened, of course, we knew what to do. And people, we were well in touch with them. So it's not about what sort of intervention, whether it's harmless, it's purely harmless, but sometimes how does it affect the brain and how the trauma might resurface. So that's also to keep an eye on. But however, I can assure everybody that it's 100% recovery. I'm not talking medically and scientifically. I'm talking by my experience. There is 100% recovery. You don't have to live with it. And let's talk with the hope, and let's talk with the real change in the real life world. So I'll stop the recording.